Hi everyone, and welcome to Ask the Horse Live. I'm your host, Haley Peffer, digital editor at thehorse.com. Caring for a horse with a long-term illness or injury requires both financial commitment and practical planning. Veterinary bills, medications, specialized feed, and management adjustments can add up quickly, so creating a clear plan helps owners prepare for ongoing expenses. Practical management, such as adjusting your horse's workload, providing appropriate turnout, and maintaining a consistent routine, can support your horse's well-being. This event is sponsored by Care Credit. To answer your questions, we are joined by expert panelists Dr. Nathan Canada of Texas Equine Hospital and Dr. Christy Gran of Conley and Kuntz Equine Hospital. Welcome to both of you.
Thanks for having us.
Yeah, thanks for having us.
Dr. Canada, can you tell us a little bit about your background?
Yeah, absolutely. So I'm originally from central Oklahoma, and I remember, like a lot of vets, being a young kid, probably around the age of 8 or 9, when I was at one of our friends' ranches, and they had a stallion that started colicking. They called out the vet, and he drove up, did his exam, gave some, medications, and tubed the horse, and the horse got better. And I thought to myself, man, that's a pretty cool job, You get to be outside, be around animals, and it seemed to be mentally engaging. And I thought that's the first time I remember being like, I want to be a veterinarian. And so I told my parents, and my mom said, well, if you're, gonna invest this much time and money into becoming a vet, you better go find out what you're getting into. And so when I was 12 or 13 years old, I started working at a mixed animal practice that, did everything from cows to horses to cats, and I really just fell in love with the horse side of things. And I ended up working there for almost 10 years in total. And fast forward, went to Oklahoma State for my undergrad, and then was lucky enough to get accepted into vet school there. During vet school, I'd say one of my biggest accomplishments was marrying my wife, who I had dated since I was a junior in high school. And originally our plan was to move back home and work at that practice that I grew up in. But as life has it, things change. And in vet school, I was blessed enough to have a really good mentor who was a surgeon, and he took me under his wing, and I saw firsthand what could be done in these really difficult cases. And I thought, I want to go on and I want to learn more. So my wife and I packed up and moved to Ocala, Florida, where I did an internship at Peterson and Smith Equine Hospital. After my internship year was up, I ultimately got accepted into a surgery residency at Kansas State University. During my time there, we were blessed with 2 beautiful little girls, which was fun, but added to the juggling act of trying to finish up a residency and being a dad. But I wouldn't have traded anything in the world for that. And then after I got done with my residency, I accepted a position as a staff surgeon here in Texas at Texas Equine Hospital, and we've been here ever since. Since being in Texas, we've had 3 boys, so there's never a dull moment in our household. Between work and kids' extracurriculars, we're pretty busy.
Awesome, thank you. And Dr. Gran, can you tell us a little bit about your background?
Yeah, so I also grew up with horses and was the stereotypical little girl that loved horses and wanted to spend the rest of my life doing horses, and didn't really know that veterinary medicine was where I wanted to be, but I knew some type of medicine all through high school, kind of honed in on either medical school or veterinary school, and ended up at the University of Findlay in Ohio with the intention of riding horses. Never actually rode while I was there, but ended up in their pre-vet program, which was very hands-on, kind of solidified my wanting to do vet school. Ended up at vet school at Tufts in Massachusetts. I'm a New Englander at heart, so grew up in Connecticut. So going back to Tufts was like going back home for me. When all the way through vet school, I wanted to be the James Harriet and do mixed animal practice, no intentions of doing internship, no intentions of doing residency. got talked into doing an internship at Purdue, and during that time, it blended into, I really like internal medicine. I like the challenge of it. And so I ended up doing a residency and staying just in equine practice. So pretty much changed everything I really wanted to do. I also was lucky enough during my education to meet my husband, who is a vet tech and was working at the large animal hospital at the time. So when I finished my residency, we left Purdue married, and ended up kind of bouncing around a little bit. The job market wasn't great at the time that I finished my residency. We ended up in New England, close to my parents for a while, where we had both of our children, a boy and a girl. And then in 2018, we moved back to the Midwest, which is where my husband is originally from, and have been here in northeastern, Indiana ever since. Same thing, kind of balancing the kid work situation. I feel like when I'm not running around seeing horses, I'm either driving to soccer or swim. So we're all pretty busy here too.
Thank you. Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. So my first question is for you, Dr. Canada. It's from Debbie in Florida, who wants to know how often you should retest a horse confirmed with PPID who is being treated with Pergolide.
Yeah, thanks for the question, Debbie. For my PPID, which PPID stands for pituitary pars intermedia dysfunction. Say that 5 times fast. That's why we have an acronym, But for my cases, I follow the guidelines that have been set out by the Equine Endocrinology Group, which I guess this is a plug for their website. There's lots of good information there for owners and veterinarians alike. So if you have questions that go beyond what we discuss here, I refer you to go look up that website and get more information. But following those guidelines, what I typically do in my cases is once we've diagnosed PPID, we'll retest the horse in 3 months. And that's just so we can assess how the medication is affecting the ACTH levels, which is what we test for. What I do from there is really dependent on clinical response. That's determined by weighing what we see, improvement of clinical signs versus, the improvement of the lab values. If I'm getting a good response, I retest once or twice a year. If I'm having some persistent clinical signs that may require increasing the Pergolide dose, I'm checking those horses more frequently. I tell owners that I put more emphasis on resolution of clinical signs than what the number on the lab paper is. But just for example, I have some patients that never go down to normal levels. They always have abnormally high ACTH values, but they're doing great clinically. In that instance, I'm not in a rush to really increase the Pergolide dose, and I kind of keep them on a once or twice retesting unless something changed. So I'd say there's not one single recipe for what we do in these instances, but for horses that are responding well, once or twice a year, getting their endogenous ACTH levels is typically adequate. One other thing to note is the time of year in which you test can be important. So there's natural seasonal variation in those levels, which can peak in the fall months. So it's important to compare samples that are at the same time of year. However, where I practice, which is in the southern United States, I will say I don't really see much of that rise in the ACTH values in the fall, which is what's typically reported. But again, that's because I'm in a more southern locale, and those values rise and fall based on how much light they have in the day. And so we have a more consistent day length, but places in other regions can have quite variable ACTH levels. So you could, if you're not comparing at the same time of year, you could think that you have an abnormally high ACTH level when it could be just normal variation.
Awesome. And Dr. Gran, Anne in North Carolina, says her horse has osteoarthritis in his neck, which can cause him to be intermittently ataxic in his hind end. Why is the ataxia not consistent?
So that is a great question. So just to kind of review the question, osteoarthritis is basically arthritis is what we call it in the neck. Usually happens along the sides of the cervical vertebrae. Can minimize motility or range of motion, in the neck, but also can impinge on the spinal cord itself, depending on where exactly that arthritis is. One of the things to understand about the spinal cord is that it's not just the cord itself. There's nerves that kind of come off of the sides of them and kind of feed into various areas of the body. And so if you have a neck lesion, whether it be arthritis or, cervical malformation, even like something like EPM, something of that nature, it's going to affect the hind end because there are nerves that travel that far as well. So there's various ways that we can localize lesions, and one of the ways that we do it is identifying how severe grade-wise our ataxia is in the front end versus the back end, and that helps us decide where along the spinal cord it is. And oftentimes with cervical lesions, so in the neck, we end up with hind end ataxia that's not quite as bad as the front end, but still present. The reason it's probably intermittent and not happening all the time is because with arthritis, bony growths, it's not going to push on that spinal cord or cause inflammation in the spinal cord the same way every single time that horse flexes his neck a different way, turns his head a different way. And so it may very much depend on what that horse has been doing in the recent past in regards to where exactly the swelling or the inflammation is in the spinal cord that's causing that ataxia.
Awesome, thank you. And Dr. Canada, Judy in Nebraska asks how owners should handle summer sores or other wounds that linger.
Yeah, that's a good question, Judy, because it does cause that whole lingering wound causes lots and lots of headaches for many owners. My first bit of advice would be that we identify what exactly is going on. There's no way one can look at a wound and say, oh, yeah, that's a summer sore versus a sarcoid versus exuberant granulation tissue or what we call proud flesh. The way to figure it out is to do a biopsy and plus or minus a culture if you're suspected of infection in the tissue. So I'd say your first step is identify and confirm that it really is a summer sore. It's also important to say that just because you start out with one thing doesn't mean it can't change into something else. We just had a case in our hospital that started off as a summer sore. We confirmed it with a biopsy, started treatment, but it just wasn't getting better. It was actually getting worse despite having the appropriate treatments on board. So we ultimately went back, biopsied again, and then found out that during all this, the horse had developed a pythium infection. So I guess the moral of that story is if things aren't progressing in the way that they should be clinically, it's never wrong to go in and do more diagnostics. And in the case of wounds, that means get more biopsies, to make sure we're treating appropriately. If your vet is going to cut something off, have them biopsy it. But in regards to kind of wound management in general, I would say bandaging is of the utmost importance. If we're not bandaging appropriately, you're not going to allow the wound to heal in a timely fashion. I mean, those non-stick wound pads like a Telfa pad are essential. And that kind of leads us to what we apply to the wound is also incredibly important and dependent upon what stage of wound healing we're in. There's no one cream or ointment that's going to be beneficial in all stages of wound healing. So having your veterinarian involved to identify what's going on and what needs to be done at that specific time point is really important. I mean, this is a big topic, and we could take all night talking about wound healing. But kind of getting back to, the summer sores, what I typically do is go in and surgically debulk the wound bed itself, because what a summer sore is the body's response to a parasitic infection. So the horse gets this parasite called Habronema from flies that feed on the wound. Habronema is a nematode, which is a worm-like parasite that actually burrows into the wound bed, and it causes massive inflammation in the subcutaneous tissues. And that because that inflammation, that causes what we call exuberant granulation tissue, or what's colloquially known as, proud flesh. So treating that condition is multifaceted. We can treat topically, but that's only going to get on the surface of that wound, and these parasites have burrowed down in the deeper tissues. So I found the fastest way to resolve this infection is to surgically debulk, which means go in and carve out all that tissue, so that you get all the nematodes out of there and they don't just keep causing this massive inflammation. So in cases that I manage with severe summer sores, I go in, cut it out, and then as well as we treat the horse with steroids to help calm down the immune response to the parasite, and then put the horse on an antiparasitic drug like ivermectin to get any lingering nematodes that are in there. But it can't go without saying that we have to have good wound care in that, which in this case means keeping that wound bandaged to prevent more flies from coming in and depositing more parasites into the wound. So just sum it up, surgical debulking, topical wound care, and medications are your best ways to manage summer sores.
I'll just add to summer sores is something that having always practiced, except for 1 year in the Northeast or Midwest, that we used to say we didn't see summer sores. And I would caution anyone listening that if you are anywhere other than probably Alaska and even maybe the southern part of Alaska, if you have a non-healing wound, definitely consider summer sores, because we've seen a bunch of it even up here in northeastern Indiana, which is not how it used to be. So don't rule it out because we're not in the South.
Dr. Gwen in Florida says medications for her horse with PPID are expensive in the long term. Are generic versions of common medications for horses with chronic health conditions safe and effective?
So I hear this question a lot. So specific to PPID, there actually is no generic. I think some people get confused between the difference between generic and compounded. So we have our brand name drugs, and we can use like Aleve, I guess, for example, right? So Aleve is a brand name, but naproxen, I think it's naproxen, is the drug name, the generic name, and you can go to Walmart and buy their version of it, right? With PPID, there's the pink pill, the FDA approved brand name drug, but there is no non-brand name drug. So if you're getting something that's pergolide other than the FDA approved drug, then it's going to have to be compounded, which basically means that a special pharmacy with minimal regulations has put together a formula that includes that drug and whatever other carriers they want to put in there. The problem with compounded drugs, and I think we'll see this discussion later on in these questions, is that on the veterinary side, there is not required regulation. There is voluntary regulation. But basically, I could go to my basement, sweep up whatever is on the floor, put it in a bottle, and tell you that I compounded whatever, acetaminophen or something like that, and you just have to believe me. There's nobody testing those drugs, making sure that that's what it is, that it is effective in that specific concentration, that it has a good shelf life, or quite frankly, that it absorbs appropriately and will work well in that horse. So specific to the PPID question, and we're talking about the drug of pergolide, and there's, again, only one brand name, that drug in that formulation has been heavily studied. We know that the way that it is packaged in the peel pouch is imperative to the stability, the shelf life of that specific pill. We know the best way to administer it to a horse. There have been studies that show us how well it gets absorbed, how fast it gets absorbed, and how well it actually works. So with some common medications, yes, there may be generic versions, and that would be a great question for your vet, but specific to PPID, there is no generic version that you can count on. There's a bunch of different compounded versions, but I always caution people against using that because of the unknown. So I get this question at least once a week because it is expensive, unfortunately.
Dr. Canada, I know you're a surgeon, but Jennifer from our live audience would like to know if there are other treatment or modalities available to treat a cervical disc issue besides surgery.
The short answer to that is it just depends on the significance of that. I mean, there's lots of anti-inflammatory medications and there's physiotherapy and things that we can do to help alleviate the pain in that, but this can be a degenerative process, and ultimately, without knowing how far along on that process we are, you can have treatments that just fail. So I would start, and I always like to start very conservatively, with, like I said, physiotherapy, anti-inflammatories, making sure the horse has good mobility. But eventually, most cases will degenerate to a time where you need surgery, to keep the horse going, which is something surgeons like to say because that's what keeps us in business, right? But there's lots of things. I mean, some other things I've done and had some success with would be like shockwave therapy, localized injections in the area. But I will tell you, a lot of these degenerative cases like that do often get to a point where all your other therapies, leave you needing more.
And Dr. Gran, Susanna from our live audience would like to ask about solutions for fecal water syndrome. She says it's especially bad in the cold winter weather when the hind end cannot be cleaned well.
Well, when someone comes up with a solution for fecal water syndrome, I will be happy to share. It is one of the probably top 5 most frustrating things to deal with as an owner, but also as a veterinarian. There really isn't any specific data out there as to what exactly causes it, which then makes us be challenged in regards to figuring out what makes it go away. One of my big frustrations with it is that it's not the same in every horse. So there's some horses that definitely are worse during the winter months, which is where you end up with the poopsicles on their hind end and in their tail. And it's a hard time of year to bathe them unless you're in Texas. And we struggle finding exactly what makes it go away. I've had several that I've biopsied rectally to make sure that we don't have any severe inflammation, and a lot of them actually come back completely normal. So I think in some of these horses, it's a motility problem, that stuff's just moving too quickly through the gut. For whatever reason, it's not absorbing the extra water. Most people report fecal water syndrome as like normal manure, but a ton of water around it, like kind of sloppy. And some people report it as like actually cow pie, so you couldn't really make fecal balls around it. I think diet is one of the easiest things to play around with to try to figure out what works best for your horse. And again, some all horses are different. There's some that do better on grass. There's some that do better on hay. There's some that can't have hay. I think a lot of them tend to do pretty well on a complete pelleted feed, like a Equine Senior, that's easy to digest. And then, there's a million different medications and supplements that you can use. I usually start people out on a trial, and I'll give them my list of, I've got a couple of supplements from a variety of companies that I'll have them try, and if in 30 days they're not at least seeing some improvement, then we switch to something else. There's antibiotics that we can try. There's, oral, basically clay substances that we can try. But unfortunately, there really isn't one thing that makes it go away.
Dr. Canada, Kimberly in British Columbia wants to know what the long-term management and treatment options are for horses with kissing spines.
Kimberly, this is a question we get at our practice almost on the daily. So you're not the only one wanting to know what to do. We see a ton of this in Texas, and we treat it quite frequently. Before we get into treatment, I just got to say, you have to understand, just because we identify a horse with radiographic changes consistent with kissing spine, that does not mean it's causing a clinical problem. So if you brought me 100 horses and you said, man, these horses are great, they're performing at the level I want them to, I have no issues whatsoever, I just want to know, do these horses have kissing spine? I guarantee you that 30 to 40 of those horses would have some form of radiographic change that would be consistent with reduced spacing in the back, which is what's called overriding dorsal spinous processes. Obviously, in this hypothetical group of horses, it's not causing a clinically significant problem, so there's really no need to treat that, but I would say that making the horse really engage the back and how you ride the horse is important to not make it worse. But the flip side of that coin is there's a subset of horses where this causes a clinical problems that can be performance limiting. So treatment, again, is multifaceted approach. The cornerstone of that being physiotherapy, but other things that we do is anti-inflammatory therapy, soft tissue pain modulation, and then, if necessary, surgery. No matter, like going back to the physiotherapy, no matter what we do, if we don't correct how the horse is engaging its back, we're going to have failures. Just like if you or I go to the doctor and say, man, I've got some back pain, your doctor's going to tell you, well, you got to strengthen your core. No way around it. And it's the same in horses. I think we've allowed horses to get away with bad posture when riding, and it has really played in to this condition. So we must make sure that the horse is fully engaging and lifting that back when riding, because this will help stabilize those processes that are impinging on one another, and it can even help further reduction. Now, it can help for the reduction, but once you have spaces that have kind of come together, physiotherapy can't really open those up for various reasons. But what we need to do in those spaces that are reduced is alleviate pain. So pain stems from the muscle that's around that process. There's a neuritis that occurs because there's nerves in between those processes that are inflamed, and then you have the bone pain. So ways to help modulate that pain have been mesotherapy, shockwave. You can inject the back with a combination of corticosteroids and pain modulators. I like to use Serapin in those instances, but these treatments don't always give us a long-lasting result. And in instances where we can't maintain that comfort, I look to surgery for a more long-term solution. And I would stress that not all surgeries are created equal. So in my practice, the amount of overriding of those spinous processes that we see can't really be relieved by going in and just cutting that interspinous ligament, which was the first kind of surgery that was published about treating kissing spines. It can help some that are close, but not really touching. But in our practice, I mean, it looks like these two spaces are crammed together and they have all this reaction, and you can cut that ligament, but they still stay really close. So I perform what's called a segmental ostectomy, and that's where we take a small sliver of that bone that's overriding. We actually cut it out and we create a new space in between those processes. What we've found in our practice is that 80% of the horses go back to the same level, if not better, after surgery. But that process of getting better is a long one. I mean, you're going to be rehabilitating that horse for 4 months, and what you do in that instance, in that 4-month period, I think is really important. It's not just, turn the horse out and then go get on him in 4 months. There's some rehabilitation that we need to do to build those epaxial muscles. The only thing I tell people I really don't like with a post-op back surgery is swimming the horse, because if you look at a video of a horse swimming, they really kind of sink their back in. So they arch their neck up and they sink their back down, and that's the opposite of what we want to do. I have a lot of clients that will go and do aqua tread. There's the Pessoa system that you can do ground lunging with. And so as we're in that 4-month period, once we get to the point where the horse can start getting back into exercise, we want to get them strong in those back muscles and make sure they're carrying the back correctly. Because if I go in, open those spaces up, but we let the horse just go back to hollowing that back out, we're going to have subpar results. So that's a long-winded answer for make sure your horse has good posture when they're riding.
Dr. Gran, Donna in Michigan wants to know how veterinarians treat EPM in horses and what she can do to manage his health long-term.
So we went from one overdiagnosed issue to another overdiagnosed issue. So EPM, the first thing I usually caution people when they ask me about EPM is, let's make sure that this horse actually has EPM. And so one of our challenges with EPM is the only way to actually diagnose it is by necropsy. And once you've necropsied a horse, you can no longer ride it. So we are left with looking at antibodies to tell us whether or not that horse has been exposed to the organism that causes the disease and therefore is at risk for having developed the disease. A lot of people are very familiar with pulling EPM titers. Titers are basically telling you whether or not that horse has had the opportunity to be infected, but has in the meantime built a way to fight it off. So if I went and got a flu vaccine, I will now have a flu titer. Same with horses. If they see EPM in the wild, their body is going to create antibody against that to try to fight it off. And so one of our biggest, in my opinion, biggest challenges with EPM is actually not jumping to conclusions based off of titers. And I would wager to say at least 50% of the EPM positive horses I've seen are not actually affected by the disease. There are many more common neurologic diseases that are causing that. So that's my first thing. We've moved and pushed for a while now that doing CSF taps, which there's a variety of ways to do them, and they're all relatively safe and very feasible to do. That is your best bet for accurately diagnosing EPM. Long term, one of the things to understand about EPM is that it is basically a parasite that gets into the spinal cord and brain and moseys itself around, creates these tunnels, holes, and paths that it travels in the same time that it's creating a ton of inflammation. And so both of those things are causing the clinical signs that you see, typically ataxia or wobbliness. It can be as severe as I'm down and can't get up to I just am not walking right, or I have a weak tail pull or something like that. EPM does what EPM wants. So depending on where in the spinal cord or brain those holes and inflammation are is what's going to dictate what clinical signs those horses have. So the majority of them are going to show you true ataxia. There's some that are super random. I've had one that just couldn't swallow properly, kept choking intermittently. I've had one that, or we've had plenty actually, and I'm sure you two have had them, Dr. Canada, is that they are lame, but they're not actually lame. They're neurologic. And so it's one of the more challenging things to identify. So back to the holes and the inflammation, our initial treatment on the inflammation side of it, once that starts to go away, sometimes the first bit of improvement in your clinical signs is what you're going to see. And as those holes start to repair, the nervous tissue repairs, then you're going to see kind of long-term treatment. When we look at neurologic horses, we grade them on a scale of 0 to 5. So 5 being down and can't get up, and 0 being perfectly normal. 3 is what I call student neuro, so very easy to see. An owner can identify it. And then we have the more subtle and then the more severe. In general, we say that we can usually guarantee that a horse will improve at least one grade level, which means that if you have a horse that's very subtly neurologic, then long term they likely are going to do very, very well, and you won't have many issues at all. But if you have a horse that's a grade 3 or 4 neuro, when you first start treatment, you're very unlikely to completely recover because there's permanent damage to the spinal cord and brain, again, depending on where the parasites are. So managing health long term is kind of a vague, difficult question to answer, because in general, we're not dealing with the parasite sticking around in the spinal cord and staying there. Once it's gone, it's gone, but the damage is what gives you your long-term effects. The other thing, I was taught the rule of 3. So if you've seen improvement in 3 days, great. If you've then seen improvement in 3 months, awesome. 3 days, 3 weeks, 3 months. So if you've seen improvement in 3 days, great. If you make it to 3 weeks and you're still seeing improvement, awesome. If you're not seeing improvement by that 3-week point, then that's basically what you can count on having later. If you go and you continue to improve until you're at about 3 months, in general, that's going to be where where you stick. So EPM is one of those rough ones. One, because I think it's way overdiagnosed, but two, because it does so much permanent damage long term.
It's funny that these were grouped together because I always say kissing spine and EPM are the last bastion for the diagnostically destitute. So, you know, it's
and Lyme
just,
disease. You throw Lyme disease in.
yeah. So.
Dr. Canada, Sue in Indiana asks how to manage a horse with a soft tissue injury that needs to be on stall rest for an extended period of time, but doesn't typically handle being stalled well.
Yeah, so you're experiencing a common problem there. Lots of horses just have major problems when you want them to, you know, be still, and they just can't handle it. But it's a common complaint when we're dealing with these soft tissue injuries that can take quite some time to heal. But first off, I want to say there's nothing magical about being in a stall, okay? Stall confinement just means that we're wanting to reduce movement and stress put on whatever specific area we're trying to heal. There are horses that actually do more damage to themselves being in a stall compared to if they're in a small turnout. You know, like if you have that horse that is just, I mean, pacing and digging holes in the stall, they are not doing what stall confinement is wanting them to do. So the goal of rest is to keep the horse cool, calm, and collected. And what environment does that is different for each horse. I mean, that said, there's things we can do to help horses that are anxious in a stall. You know, it can be as simple as having a buddy next to them. A lot of problems happen when you put this one horse in the stall and then turn all the herd mates out and they're like, I'm being left, you know. But you can keep someone up to keep them company, or you can even have a companion animal like a small mini. And the in vogue thing in Texas right now are goats, these companion goats. I see them all the time. I don't know when that became a thing, but it is now. So, but get yourself a goat, I guess, if you need some help. But they can help them kind of bond and think I'm not being left, you know, and I'm going to die because I'm all alone. But environmental enrichment can benefit some of these horses, and what that does is it's just keeping them from being bored in there, stuff for them to do while they're sitting in the stall. Even horses that I want them to be on stall rest, I have my owners get those horses out and get them in the sunlight, you know, get that vitamin D therapy for them. Let them be a horse, let them graze some grass, do it in hand, make sure, you know, they're not running off. But there's rarely instances where I say you can't hand walk this horse. Typically, for most our soft tissue things, hand walking is what we want them to do, and so get them out quite frequently so that they can have some time outside of those four walls and you know, just be where they were meant to be. But in some cases, even if we're doing all these things, it isn't enough, and we have to turn to other means to try to reduce horses' anxiety. A more holistic approach would be supplementing with the various supplements that help having a calming effect. Most of these supplements have magnesium, but there's some other products that are in there, so you can talk with your veterinarian about what they recommend and what's available there. But I have had good luck just, you know, taking them down a little bit with some magnesium. But there is a subset of horses that, you know, they're not going to calm down, and we have to turn to medications. And so there are some long-acting sedatives. Now, you need to know that, you know, nothing doesn't have its downside. So there can be some complications that you can have to long-acting sedatives, and it's a controversial topic of what people choose. But I'll just tell you what I've used is reserpine, and you can get it in various forms. It can last up to 30 days, depending, on what formulation you use. I use that as a last resort, but again, I would try implementing all the other things, I mentioned earlier before just pulling out a medication and giving it to the horse.
If this is the Sioux, I think it is in Indiana, Dr. Canada, if she calls our office tomorrow and says that she has a goat, you're in trouble.
It must be doing something because I'm seeing more and more of them. So
we see them too. Yeah. Goats and minis, both, I think, equally.
That's awesome. Dr. Gran, Brian in Tennessee asked how he can plan ahead for expenses related to caring for a horse with chronic laminitis. He has both regular and emergency expenses that come up when the horse has a laminitic episode.
So that is a great question. And there's no arguing that chronic anything is very expensive in the long run. The specific to laminitis, I think the first thing I would do is encourage appropriate management of the cause of the laminitis, right? So I presume that there's probably some metabolic or Cushing's background in this story, working with your veterinarian to make sure that you've got this horse to the point where you're minimizing those flares as best as possible, working with your farrier to get good quality shoeing and trimming based off of current radiographs. All of those are important to minimize those flares. There really isn't a reason why a cushingoid or metabolic horse that's well managed should be having regular emergency visits for laminitis, because you should be able to be picking up on those over time. Obviously, there's other reasons for laminitis, and those can be a bit more complicated. From a, how do we handle the cost side of things? The best that you can do is budget, right? So look back on what you've spent, maybe just in total over the last year. And, if you've spent, $12,000, which is a lot, but if it's $12,000 in the last 12 months, then try to set aside $1,000 every month to veterinary expenses. Whether you use it or not, then it's there as a help. The other thing to consider is care credit, which I think is available to most individuals to kind of have that backup plan for emergencies or some sort of credit card. Not that I promote going into debt for your animals, but sometimes, things take us all by surprise and it has to happen. But again, specific to laminitis, I would encourage a very in-depth consult with your veterinarian in regards to making sure your horse is well managed to minimize those laminitic flares over time.
Dr. Canada, Cheryl in Pennsylvania asked how veterinarians manage horses with navicular syndrome. Have there been any recent updates in research on this topic?
Yeah, thanks, Cheryl. I would say the biggest change in recent history would be the use of MRI when we diagnose heel pain. So historically, if you brought me a horse or brought your veterinarian a horse and we do a nerve block and it blocks to the heel, we take some x-rays, and that all got lumped into the navicular syndrome because we didn't necessarily know what was going on if radiographs didn't show any change in the bone. So that's all we could talk about, was what the radiograph was finding on there. And you have some horses that have pristine radiographs, but they are crippled. And then you have some horses that have really pronounced changes, and they're relatively functionally sound, And what we found after a couple decades of putting horses through MRIs that block out this way is that those horses with or without navicular bone change generally have some soft tissue lesions or abnormalities that occur in that heel area. Most commonly, we're dealing with the deep digital flexor tendon. and it can have tears or strains. Then you can have problems within the navicular bursa. You can have inflammation, which is called bursitis, or you can have adhesions, which is actually where the tendon and the navicular bone kind of are glued together right there due to inflammation that occurs. There's also various ligaments that attach to that navicular bone and keep it in the spot that it's supposed to be, and they can have desmitis, which is the doctor term for inflammation within that ligament itself. So this information that we get from these MRIs has helped us better pinpoint, treatment and focus therapies so that we now can treat the various soft tissue lesions that occur along with the change in the navicular bone. I mean, in regards to those specific treatments, the most common thing that's been used has been corticosteroids, and that's an anti-inflammatory, that we put in the bursa itself, and has been the most common treatment modality. But more recently, we have use of various biologic agents that can help with anti-inflammatory effects, but also have healing effects in the soft tissues, which have been a game changer in some of these horses with heel pain. And I guess I should back up and say corticosteroids are good about taking out inflammation, but they kind of blunt the healing process. So you might make the horse feel good for a little bit, but you prolong, the soft tissue healing. So you're kicking the can down the road. But and that's why these biologics are helpful. We also here more recently have had hydrogels, which are synthetic lubricants that you can put in the bursa itself, and that can help lubricate and buffer the tissues there. That I use in horses that have erosions or kind of loss of the cartilage on the back of the navicular bone that can affect that tendon. But that's helped some of these horses that have had poor response to previous treatments. And then there's the class of drugs called bisphosphonates that you can give the horse, and that helps inflammation directly in the bone. Some horses require one of these treatments, or some of them need a combination of therapies to keep them comfortable. But there's also surgical options now that we can do. A neurectomy, where you take what's called the palmar digital nerve, which is the nerve that innervates that heel region. You can actually go in there and remove a portion of that nerve. Now, you're not fixing anything when you do that. You're just taking away the pain. And so I have to stress, this doesn't fix a problem. And it can actually be detrimental, especially if you have tendon injury and tendon tears, because if the horse doesn't feel that tendon and keeps going on it and doesn't protect it, that tendon can rupture. So MRI is really beneficial in deciding if you want to pursue that treatment. More recently, bursoscopy has kind of gained favor, and that's where we take a scope, and just like you would in a horse's knee or a stifle, but you put a scope into that navicular bursa itself, and it's used to help break down some of those adhesions that I talked about, clean up tears in the deep digital flexor tendon as it goes over that navicular bone. And we've had some good results with that in conjunction with some other therapies like biologics to help things heal. More recently, there's been one surgery that's reported where they actually go in and decompress the navicular bone. If there's a lot of navicular bone inflammation, you do that by drilling a small hole in the top of that bone. But deciding what surgical option is best is really dependent on the information that we get from the MRI, which is why it's so important. So we have lots of options. Not one treatment is good for every case. That's why you need to have good dialogue with your veterinarian so they can explain what's going on based on the diagnostics that have been done. One thing though that I can't stress enough is a farrier is just as important as your veterinarian when treating navicular disease, because proper shoeing is of the utmost importance. We can treat the horse with all that we have, but it won't change any outcomes unless that horse is properly trimmed or shod. So getting them shod and then putting them in a rehabilitation program that allows those soft tissues to heal and doesn't stress the horse too soon, but also doesn't keep them as a couch potato is important. So all that said, there's some cases where we can do everything that we have available and still not have good outcomes. So this is one of those conditions that you really need to take on a case-by-case basis.
Dr. Gran, our last question of the night is going to be for you. It's from Karen in our live audience, who is asking whether you recommend any supplements in addition to albuterol or clenbuterol and steroids for a horse with recurrent airway obstruction or equine asthma.
So yes. So equine asthma, recurrent airway obstruction, heaves, whatever you want to call it at this point, is super, super common. Lots and lots of ways that various people manage it. To specifically answer your question, supplements, yes, there is actually some data out there in regards to Alaria that has some good omegas in there that help kind of manage the inflammation in the airway. That's the only one that I'm aware of that has actual data behind it. You know, the popular supplement companies each have their own concoction, I guess, that they claim works well. And I've had some people say that it works and some people say that it doesn't. Usually when it comes specifically to supplements, and this isn't just in regards to asthma, in regards to everything, I usually tell people, you know, buy 30 or 60 days worth. If it's doing what you think it's supposed to be doing, then keep going. If it's not doing what you expected of it, stop buying it, and either try something else or stop trying supplements. Specific to asthma, I will say that I'm a firm believer in inhaled therapy for that, whether it be inhaled actually nebulizers or like meter dose inhalers, things like that. There are a lot of options out there at this point in regards to getting drugs to the airways, which is very, very helpful, especially for our metabolic horses that we're wanting to use steroids on. So I would, yes, I guess again, specific to your question, I would absolutely reach for supplements, but I would be more inclined to reach for a modification of treatment and start to include some inhaled therapies as well. The other thing I cannot stress enough is that environmental management is key. You know, I tell people, if you're allergic to cats and cats makes you not be able to breathe, you very likely are not going to have cats in your house and be able to survive with just medication. You have to fix the environment. Some things are fixable, some things are not, but improving airflow, changing bedding, wetting down hay, changing hay, all of those things is just as important as any supplement in the world or any medication in the world as well.
Well, that's all the time we have for tonight. We've covered a lot, and I hope our listeners have learned as much as I have. Thank you, Dr. Kanda and Dr. Gran, for joining me.
Absolutely, it was fun.
Yeah, pleasure to be here. Thanks for everybody for joining.
Thank you to Care Credit for sponsoring this event. And finally, thank you to our audience for listening and sending in these questions. If you're listening to us after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.